Welcome back to the channel. Today we are talking about dilated cardiomyopathy, one of the most common cardiac problem. It is important to us because it is the leading cause of heart failure. Let's break it down simply what it is, why it happens, and how we diagnose it, and most importantly, how we treat it. Definition: dilated cardiomyopathy is a disease of the heart muscle where left ventricle is dilated and enlarged with reduced systolic function. Dilatation may be global or segmental. In this photo, we see the normal heart on the left side and the left ventricle is dilated here in the right side with thinning of its wall. Clinical presentation: initially patient may remain asymptomatic. Later, progressive heart failure symptoms may arise like fatigue, dyspnea, orthopnea, and edema. Thromboembolism may occur. Regarding physical examination, pitting edema, increased jugular venous pressure, arrhythmia, lung vessel crackles, and outward displaced apical impulse, cardiac S3 gallop, and regurgitation murmur. In this picture, we see the prominent jugular vein over the neck, and here we see the pitting edema over the legs. Now come to the causes. Out of the cause, idiopathic is 50% and the rest 50% is secondary. And out of the 50% secondary, ischemic is predominant. Ischemic cause accounts for 30 to 35%. And the other secondary causes are 15 to 20%. Out of this, infective is the viral, most common, the Coxsackie Bay virus, adenovirus, COVID-19, HIV. Regarding bacterial, it is diphtheриal cause. The others are Chagas disease and Lyme disease. Non-infective, sarcoidosis, autoimmune, polymyositis, dermatomyositis. Toxic causes, alcohol, which is dose dependent, catecholamine, amphetamine, cocaine, chemotherapeutic drugs like doxorubicin, heavy metal. Metabolic causes, nutritional deficiency like thiamine, selenium, calcium, phosphate, and magnesium. Endocrine cause, thyroid disorder, diabetes, pheochromocytoma, and obesity. Familial and genetic cause, and miscellaneous. Under the miscellaneous variety is the peripartum cardiomyopathy, arrhythmia-induced dilated cardiomyopathy, and tachycardia-induced dilated cardiomyopathy. Here we see the coronavirus and also see the alcohol, most important cause of dilated cardiomyopathy. Now let us discuss about the pathophysiology. The primary injury in the myocyte causing myocyte damage with reduced contractility and remodeling of ventricle. Neurohormonal activation occurs. Under this heading, the renin-angiotensin-aldosterone system activation, sympathetic system overstimulation, causing hypertrophy and fibrosis with further dilatation and worsening of the function. Mitral and tricuspid regurgitation occur from annular dilatation of the ventricle. End stage showing spherical heart with poor pump efficiency. Here we see the heart, the left ventricle has been dilated with thinning of its ventricle. Special clinical subtypes, alcohol cardiomyopathy, often it is reversible with abstinence associated with nutritional deficiency, cocaine and toxic catecholamine cardiomyopathy. Chemotherapy induced, most important is the doxorubicin, it is dose dependent, may present months and years later. Peripartum cardiomyopathy usually occurs in the last trimester of pregnancy to up to the 6 months of the postpartum period. Risk increases with twin pregnancy, multiparity, older maternal age usually have favorable prognosis. Takotsubo syndrome, stress-induced reversible LV dysfunction, often post-emotional stress may recur. You see the alcohol, not to use alcohol, the adrenaline effect of the cardiac muscle, Here the Takotsubo cardiomyopathy, where you see Takotsubo is the jar used in Japan for keeping octopus. It has narrow neck with wide dilated body, looks like the ventricle, dilated left ventricle with narrow neck. In the ECG, we see the ST elevation like myocardial infarction. So now let us discuss about the diagnosis, how to diagnose chest X-ray. So the increased cardiothoracic ratio with shadow of pulmonary edema. Echocardiography shows dilated left ventricle with thinning of left ventricle, low ejection fraction, usually less than 40%, wall motion abnormalities. ECG non-specific STT change, arrhythmia may occur. Cardiac MRI shows tissue characterization of fibrosis and inflammation. Lab test of BNP, troponin, viral serology, iron study, thyroid function helps. In this chest X-ray, we see the perihilar bat swing pattern of the pulmonary edema, cephalization of the vessels, increased cardiothoracic ratio, Carle B line of interstitial edema, and pleural effusion. In this echocardiography, we see the dilated left ventricle with the characteristic thinning of the LV wall with reduced LV function. Management principle, what we see, the heart failure therapy comes first, diuretic source symptomatic relief, and the others AC inhibitor or angiotensin receptor blocker, beta blocker, mineralocorticoid receptor antagonist like spironolactone, SGLT2 inhibitor. It shows newer evidence in the treatment of heart failure therapy. Device therapy, implantable cardiac defibrillator or cardiac resynchronization therapy in advanced cases, transplant in the end-stage disease. Address the cause, stop alcohol, treat infection, treatment for ischemic heart disease, control arrhythmia, correct deficiency. Take home message, abstinence from alcohol, control of tachyarrhythmia, treatment of myocarditis, and correction of ischemic heart disease can improve cardiac function. Early suspicion is the cornerstone of treatment. Always search for the reversible cause because it can be life-saving. Thank you.